Welcome to the Victory Education Lounge. I'm your host, Maurice, and today we're exploring an exciting topic, Gene Therapy Revolution, Cutting-Edge Sickle Cell Treatments, Part 33. Before we dive in, please take a moment to like this video, subscribe to our channel, and leave a comment sharing your thoughts or experiences below. Your engagement helps us reach more people with this crucial information. Sickle cell disease has long been a challenging condition to treat, but we're on the brink of a revolution. Gene therapy is opening up new possibilities for treatment and even potential cures. Let's explore these cutting-edge developments and what they mean for those affected by sickle cell disease. Ever wondered how gene therapy could revolutionize the treatment of sickle cell disease? Today, we're peeling back the layers of this fascinating subject. Sickle cell disease, a genetic disorder that affects the protein in red blood cells known as hemoglobin, has been a medical challenge for years. The faulty hemoglobin causes cells to take on a crescent or sickle shape, leading to severe complications such as blockages in blood vessels, pain, and organ damage. But the winds of change are blowing, as we're on the cusp of a groundbreaking revolution: gene therapy. This innovative area of medicine is offering new possibilities for treatment and even potential cures for this debilitating disease. It's a world where science fiction meets reality, and the possibilities are as vast as they are exciting. So now that we understand the basics of sickle cell disease, let's delve into the world of gene therapy. First on our list is gene addition therapy. This innovative method of treatment for sickle cell disease takes a creative approach by adding a functional copy of the beta-globin gene to the patient's own stem cells. The beta-globin gene is a key player in the production of hemoglobin, the protein that carries oxygen in our red blood cells. In individuals with sickle cell disease, a mutation in this gene results in abnormal hemoglobin that causes the red blood cells to become sickle-shaped, leading to various complications. By adding a functioning copy of the beta-globin gene, gene addition therapy aims to restore the normal functioning of hemoglobin, thereby preventing the sickling of red blood cells. One of the key advantages of gene addition therapy lies in its use of the patient's own cells. This significantly reduces the risk of rejection that can occur with therapies using donor cells. The patient's stem cells are collected, treated in the lab with a virus carrying the functional gene, and then returned to the patient. This essentially creates a self-sustaining factory of healthy red blood cells within the patient's body. However, like any groundbreaking therapy, gene addition therapy comes with its own set of challenges. The procedure to collect, treat, and reintroduce the patient's stem cells is complex and requires a high level of precision. Additionally, while early results have been promising, we are still learning about the long-term effects of this therapy. It's a bit like venturing into uncharted territory. But the potential rewards could be life-changing for those affected by sickle cell disease. So, there we have it. That's gene addition therapy, a complex yet promising approach. It's an exciting time in the field of gene therapy, and we're eager to see how these developments will continue to evolve in pursuit of a cure for sickle cell disease. Next, we have a revolutionary technique, gene editing with CRISPR-Cas9. This game-changer in the world of genetics is often likened to a pair of molecular scissors. It allows scientists to directly edit or cut and paste the DNA at precise locations. In the context of sickle cell disease, CRISPR-Cas9 is used to accurately edit the faulty beta-globin gene causing the condition. Imagine you're reading a book and you find a spelling mistake. With a regular pen, you can only cross it out or write over it, but it's never quite perfect. Now imagine having a magical pen that lets you erase the error and write the correct spelling without any marks. That's CRISPR-Cas9, but for our genes. The potential benefits of CRISPR-Cas9 are immense. Its precision means it could be a one-time treatment, editing the faulty gene once and for all. This could eliminate the need for ongoing treatments, significantly improving the quality of life for patients. But as with any new technology, there are challenges and risks. CRISPR-Cas9 is still in early clinical trials, and while the results are promising, there's much we don't know. One of the biggest concerns is off-target effects. This means the CRISPR-Cas9 system might accidentally cut DNA at places other than the intended target. Such unintended edits could potentially cause other health problems, including cancer. Another challenge is the delivery of the CRISPR-Cas9 system into the patient's cells. The system needs to be delivered into the patient's stem cells, which is a complex procedure. Researchers are currently exploring various methods, including using viruses as delivery vehicles. In spite of these hurdles, the potential of CRISPR-Cas9 is undeniable. Scientists around the world are working tirelessly to refine the technique and overcome these challenges. It's an exciting time in the field of gene therapy, and CRISPR-Cas9 is at the forefront of this revolution. Despite its early stages, the precision of CRISPR-Cas9 holds great promise. Now let's explore fetal hemoglobin reactivation and mRNA therapy. Diving into the realm of fetal hemoglobin reactivation, this technique aims to reactivate the production of fetal hemoglobin in our bodies. If you remember, fetal hemoglobin is a form of hemoglobin that is naturally resistant to sickling, the problematic process that gives sickle cell its name. By reviving this innate defense mechanism, we may be able to prevent the formation of sickle-shaped cells altogether. The beauty of this approach lies in its simplicity. It leverages a natural process, potentially leading to fewer side effects. However, it may not be effective for all patients, and the long-term durability of this method is yet to be fully understood. On to our next stop, mRNA therapy. You might recall hearing about mRNA from the COVID-19 vaccines. In the context of sickle cell disease, scientists are exploring how to use mRNA to instruct cells to produce correct hemoglobin. The key advantage of mRNA therapy is its potential ease of administration compared to other gene therapies. However, one potential drawback is that it would likely require ongoing treatments, as the body naturally breaks down mRNA over time. This therapy is still in early development, but it holds great promise for the future. It's important to remember that while both these techniques hold immense potential, they are not without their challenges. Fetal hemoglobin reactivation, while leveraging a natural process, may not work for every patient, and the long-term effects are still being studied. Similarly, mRNA therapy, while potentially easier to administer, may need regular doses and is still in its infancy. But don't let these challenges dampen your enthusiasm. As we're learning, science is all about trial, error, and perseverance. The goal is to continue to refine these techniques, improve their effectiveness, and minimize any potential drawbacks. Both these techniques leverage the power of our body's natural processes. And isn't that a beautiful thought, that we could use our own biology to heal ourselves? Stay tuned as we continue to explore this exciting frontier in the next segment. Some researchers are not stopping at just one technique. Instead, they are pushing the boundaries of innovation by exploring combination approaches. This involves merging different methods of gene therapy, such as gene addition therapy and CRISPR-Cas9 or fetal hemoglobin reactivation and mRNA therapy. The idea is to capitalize on the strengths of each technique, potentially providing a more comprehensive treatment for sickle cell disease. For instance, combining gene addition therapy with CRISPR could potentially allow for the precise correction of the faulty gene while also adding a functional copy, thereby doubling the chances of success. Similarly, a blend of fetal hemoglobin reactivation and mRNA therapy could work together to increase the production of correct hemoglobin. However, these combination approaches are not without their challenges. The increased complexity could potentially lead to more side effects or interactions. Despite this, the potential benefits could far outweigh the risks, paving the way for groundbreaking treatments. The complexity of combination approaches may lead to greater effectiveness. Here are some real-world examples of gene therapy in action. First up, in 2019, a team at Boston Children's Hospital embarked on a gene therapy trial with several sickle cell patients. The results were inspiring. 2 years post-treatment, these patients remained symptom-free, their blood tests showing no traces of the disease. Next, we turn to the National Institutes of Health, where researchers utilized the groundbreaking CRISPR gene editing tool. They successfully treated a patient with sickle cell disease who, prior to the treatment, was reliant on frequent blood transfusions. Post-treatment, this patient no longer required transfusions, a significant milestone in their disease management. In another corner of the world of science, a clinical trial by Bluebird Bio added a modified beta-globin gene to patients' stem cells using a lentiviral vector. The outcome? Several patients in the trial have remained free of sickle cell crises for years after treatment, showcasing the potential longevity of gene therapy's impact. Meanwhile, scientists at St. Jude Children's Research Hospital developed a gene therapy approach that reactivates fetal hemoglobin production. Early results in clinical trials have shown promising reductions in pain crises and hospitalizations, making this an exciting area to watch. Finally, in a groundbreaking study, researchers at Stanford University combined CRISPR gene editing with a technique to increase the production of fetal hemoglobin. This combination approach, while still in the early stages, points to the potential of multiple therapies working in tandem to combat sickle cell disease. These examples highlight the potential of gene therapy to change lives. They underscore the determination of scientists to push boundaries, to defy the status quo, and to revolutionize the treatment of sickle cell disease. The future of gene therapy is here, and it's reshaping the narrative for patients around the globe. Before we wrap up, I want to emphasize that the information in this video is for educational and entertainment purposes only. Any health-related decisions should be discussed with a licensed physician who knows your medical history and can provide personalized advice. Thank you for joining us in the Victory Education Lounge. Your support helps us continue providing valuable information about sickle cell disease and potential treatments. Don't forget to like, subscribe, and share your thoughts in the comments. Until next time, this is Maurice, wishing you health and hope in this exciting era of medical advancement.